If you are over 60 and someone told you eggs will clog your arteries, they gave you advice from 1968. And if you have diabetes, that same advice could actually put you at risk. Because in 2025, we finally have the first major study done specifically on seniors aged 70 and older. And what it found may surprise you. You know what I hear all the time? One person tells you one thing about eggs. The internet says another. My friend eats 3 eggs every morning and feels great, but my neighbor was told to avoid them completely. So who is right? And here's the thing. If you are over 60, you cannot just follow general advice anymore. Your age changes everything. Your medications change everything. Your health conditions change everything. For decades, we were told eggs were dangerous, that they would raise our cholesterol, that we should limit them to maybe 2 or 3 per week. But the science kept changing, and changing again. And most people did not keep up with the updates. So you are sitting there at breakfast, looking at your eggs, wondering, am I hurting myself? Am I helping myself? Should I eat the yolk or throw it away? Today, I am going to give you clear answers. Not my opinion, not internet rumors. Real research, including a major study published in January 2025 that followed 8,756 seniors for years. I am going to tell you exactly how many eggs are safe based on your specific health condition. Because a healthy senior and a senior with diabetes should not be eating the same amount, not even close. And I am going to share one critical safety issue that affects everyone over 65. Because there was an outbreak just this year, 1 death, 38 hospitalizations, all from eggs. So if you want real answers backed by real science, stay with me. Let us clear up this confusion once and for all. But before we start, this is educational information only, not personal medical advice. Check with your healthcare provider first, especially if you take medications. Okay, first thing you need to understand. The rules change after 60. Let me explain why. Number 1. Your body processes cholesterol differently now. Studies show about 20 to 25% of people are what scientists call hyperresponders. That means when they eat cholesterol, their blood cholesterol goes up more than average. And research suggests this percentage may be higher in older adults. Your liver function changes as you age. The way your body handles fats changes. So what worked for you at 40 might not work the same way at 65. Number 2. Your medication list matters now. Think about it. How many medications are you taking? Blood pressure medicine? Cholesterol medicine? Diabetes medication? Heart medication? Many seniors are taking 3, 4, 5 different medications. And while eggs do not directly interact with most medicines, the context matters. If you are taking a statin for cholesterol, your doctor might want you to be more careful with dietary cholesterol. Not because eggs are bad, but because your overall management plan is different. Number 3. Your infection risk is higher. The Food and Drug Administration identifies adults 65 and older as high risk for foodborne illness. Here is why. Your immune system naturally starts declining between ages 50 and 60. After age 75, your risk increases even more. Just this past June, 2025, there was a salmonella outbreak linked to eggs. 134 people got sick. 38 ended up in the hospital. 1 person died. I am not trying to scare you. I am telling you this because knowing your risk helps you stay safe. And we will talk about exactly how to cook eggs safely in just a bit. Number 4. Your nutritional needs are different now. After 60, you start losing muscle mass. It is called sarcopenia. You lose about 3 to 8% of your muscle every decade. That affects your strength, your balance, your independence. Your brain health becomes a bigger concern. Memory issues, cognitive decline. These are real worries for many seniors. Your eyes change too. 1 in 3 adults over 75 develops macular degeneration. That can rob you of your vision. So when we talk about eggs, we are not just talking about cholesterol anymore. We are talking about protein for your muscles, choline for your brain, nutrients for your eyes. Your age changes the equation completely. So what do the major health organizations actually recommend? Let me walk you through this, because the guidelines have changed a lot. Number 1. The American Heart Association updated their guidance in 2019. And here is what they said. Healthy older adults may eat up to 2 eggs per day. 2 eggs per day. Now compare that to their 1968 guidelines. Back then, they said no more than 3 eggs per week, total, for the whole week. What changed? Decades of research showed that dietary cholesterol, the cholesterol you eat, has a much smaller impact on blood cholesterol than we thought. For most people, your body adjusts. When you eat more cholesterol, your liver makes less. When you eat less cholesterol, your liver makes more. It is a balanced system. Number 2. The 2025 ASPREE study. This is the big one. This study followed 8,756 adults aged 70 and older. Not young people, not middle-aged people. Seniors, your age group. And what did they find? Seniors who ate eggs 1 to 6 times per week had 15% lower risk of dying from any cause, and 29% lower risk of dying from heart disease. Let me repeat that. Lower risk, not higher risk. This was the first major study looking specifically at older adults and egg consumption. And it suggests moderate egg intake may actually be protective for seniors. Number 3. What changed in 2015 that most people missed? The dietary guidelines for Americans made a huge shift. They removed the 300 milligram daily cholesterol limit, just erased it. They said, and I am summarizing here, cholesterol is not a nutrient we need to worry about for most people. They shifted focus to overall eating patterns instead of single nutrients. Because what you eat with your eggs matters just as much as the eggs themselves. Number 4. Why diabetes is different. Now, the American Diabetes Association lists eggs as a good protein source. But here is where it gets tricky. Multiple research studies found that seniors with type 2 diabetes face higher cardiovascular risk when they eat eggs frequently. One study found 69% increased risk. Another study from Korea found eating about 4 eggs per week led to 2.8 times higher cardiovascular incidence. This is really important. If you have diabetes, the guidelines are different, much more restrictive. And we will get specific about numbers in just a moment. So bottom line, for healthy seniors, the science supports moderate to even daily egg consumption. But if you have diabetes, you need to be much more careful. The guidelines have evolved. The question is, have you? All right, here is what you really came for. The specific numbers based on your health. Because here is the truth. Not all seniors should eat the same number of eggs. Your health conditions matter more than your age alone. Let me break this down by condition. Number 1. If you are a healthy senior with no major health issues, the research supports 1 to 2 eggs daily. That is 7 to 14 eggs per week. This is backed by the American Heart Association's 2019 guidelines. And that 2025 ASPREE study showed this range was linked to lower mortality in seniors over 70. So if you are healthy, active, no major conditions, you can feel good about having eggs for breakfast every day. Just remember, they need to be cooked thoroughly. We will talk about that. Number 2. If you have type 2 diabetes, pay close attention to this one. The recommendation is 3 to 4 eggs per week. Maximum. I know that sounds restrictive, but here is why it matters. Multiple studies found that seniors with diabetes who eat eggs more frequently face higher cardiovascular risk. One meta-analysis found 69% increased risk. That Korean study I mentioned found 2.8 times higher risk of cardiovascular problems. The American Journal of Clinical Nutrition published research confirming this pattern specifically for diabetic patients. So, if you have diabetes, eggs are not off limits. But you need to be more careful than someone without diabetes. 3 to 4 per week appears to be the safe zone based on current evidence. Number 3. If you have heart disease or you have had a heart attack, studies suggest 4 to 6 eggs per week. Now, the Cleveland Clinic recommends 3 to 6 eggs weekly for people with existing heart disease, and research found that up to 6 eggs per week was inversely associated with cardiovascular events. That means it may actually help, not hurt. But the key is your overall diet. If you are eating eggs with bacon, hash browns, and buttered toast every day, that is a different story than eating eggs with vegetables and whole grains. Context matters. Number 4. If you have high cholesterol. This depends on whether your cholesterol is controlled or not. If your cholesterol is controlled with medication and diet, research supports up to 7 eggs per week. If your cholesterol is uncontrolled or very high, limit to 3 to 4 eggs per week. Here is why. About 20 to 25% of people are hyper-responders. Their cholesterol goes up more when they eat dietary cholesterol. But, and this is important, a study from January 2025 found that people who ate 2 eggs daily with a low saturated fat diet actually reduced their LDL cholesterol. The study showed saturated fat intake mattered more than the cholesterol in the eggs. So it is not just about the eggs, it is about the butter, the cheese, the fatty meats you might be eating with them. Work with your doctor. Monitor your levels. But eggs alone are probably not your problem if your cholesterol is high. Number 5. If you have high blood pressure. Research indicates up to 7 eggs per week is fine. In fact, the Framingham study found that people eating 5 or more eggs weekly had 32% lower risk of developing high blood pressure. Eggs are naturally low in sodium, only 62 milligrams per egg, so they fit well into a blood pressure-friendly diet. Number 6. If you have kidney disease. This one is more complicated. If you have chronic kidney disease, egg whites are preferred, and whole eggs should be limited to 2 to 4 per week maximum. Here is why. Whole eggs contain 86 milligrams of phosphorus. When your kidneys are not working well, phosphorus can build up in your blood. That is dangerous. But egg whites only have 5 milligrams of phosphorus, so they are much safer. The National Kidney Foundation recommends egg whites as an excellent protein source for people with kidney disease. If you are on dialysis, you actually need more protein. But even then, egg whites are better than whole eggs for phosphorus control. Talk to your kidney doctor about your specific case. So look at that list. Find where you fit. And now you have a clear answer based on research, not guesswork. Now let us talk about the good stuff. Why would you want to eat eggs in the first place? What do they do for your aging body? Number 1. Eggs may help prevent muscle loss. After 60, most of us start losing muscle. It is called sarcopenia, and it is serious. Less muscle means less strength, less balance, higher risk of falls, loss of independence. Eggs score 118% on something called the protein quality scale. That is the highest possible rating. It means your body uses egg protein very efficiently. A 2025 study looked at 126 elderly women. They increased their protein intake, including eggs, and they saw improvements in muscle mass, hand grip strength, and mobility. Maintaining your muscle means maintaining your independence. Eggs can help with that. Number 2. Eggs may support your brain health and memory. This one is huge for seniors. Each egg gives you 147 milligrams of choline. That is about 30% of what you need daily. And choline is critical for memory and brain function. The Rush Memory and Aging Project studied 1,024 older adults. Average age was 81. They found that people eating 1 or more eggs per week had lower risk of Alzheimer's disease, and choline accounted for 39% of that protective effect. Another study, the Rancho Bernardo study, followed seniors for 16 years. They found that people who ate more eggs had better verbal memory, better short-term memory, better long-term memory. And when they did autopsies on people who had died, they found less buildup of Alzheimer's-related proteins in the brains of regular egg eaters. Now, does this mean eggs prevent Alzheimer's? No, we cannot say that. But the research suggests they may help support brain health as we age. Number 3. Eggs may protect your eyes from macular degeneration. Eggs contain lutein and zeaxanthin. These are nutrients your eyes need. One study had people with early macular degeneration eat 12 eggs per week. After the study, their blood levels of lutein increased 52%. Zeaxanthin increased 83%. And their glare recovery, how well they handled bright lights, improved 86%. Compare that to the control group who did not eat eggs. Their glare recovery declined 32%. And here is the interesting part. Lutein from eggs is 3 times more absorbable than lutein from spinach or supplements. The fat in the egg yolk helps your body absorb these nutrients. 1 in 3 seniors over 75 develops macular degeneration. Anything that may help protect your vision is worth knowing about. So yes, eggs have cholesterol, but they also have protein for your muscles, choline for your brain, nutrients for your eyes. For most seniors, the benefits may outweigh the risks. All right, now we need to talk about safety, because this matters more for seniors than for younger people. Number 1, cook your eggs until both the yolk and white are completely firm. No runny yolks, no soft scrambled eggs. The internal temperature needs to reach 160 degrees Fahrenheit. I know some people like their yolks runny, but after 65, that risk is not worth taking. Your immune system cannot fight off infections the way it used to. Number 2, never eat raw eggs in any form. That means no homemade Caesar dressing, no homemade mayonnaise, no raw cookie dough made with eggs. If a recipe absolutely needs raw eggs, use pasteurized eggs. You can find them in most grocery stores. Number 3, understand your real risk from salmonella. The Food and Drug Administration says seniors are high risk. Your immune system naturally declines starting around age 50 to 60. After 75, your risk goes up even more. That June 2025 outbreak I mentioned earlier, 1 person died. 38 people ended up in the hospital, all from contaminated eggs. But here is the good news. Proper cooking eliminates this risk completely. Heat kills salmonella. So if you cook your eggs thoroughly, you are safe. Number 4, pay attention to egg freshness. Check the expiration date on the carton. Do not buy eggs that are close to expiring. Here is a simple test. Fill a bowl with water. Put the egg in. Fresh eggs sink. Old eggs float. If it floats, throw it out. Store your eggs in the main part of your refrigerator, not in the door. The door is warmer, and use eggs within 3 to 5 weeks of buying them. Number 5, ask your pharmacist if you are unsure about interactions. Eggs are generally safe with most medications. They do not interact with blood pressure medicines. They do not interact with warfarin, the blood thinner. They are fine with most statins. But if you take immunosuppressants, medications that weaken your immune system, be extra careful about food safety. When in doubt, ask. Better safe than sorry. All right, let us bring this together. If you are a healthy senior, research supports 1 to 2 eggs daily. That 2025 study of over 8,000 seniors showed moderate egg consumption was linked to lower mortality. Not higher, lower. If you have diabetes, be more careful. 3 to 4 eggs per week appears to be the safe zone based on multiple studies. If you have heart disease, 4 to 6 eggs weekly fits into a heart-healthy diet. If you have kidney disease, focus on egg whites and limit whole eggs to 2 to 4 per week. And everyone over 65 needs to cook eggs thoroughly. That is not negotiable. your infection risk is higher. The confusion you have felt about eggs? It was real. The science kept changing. First eggs were good, then they were bad, then they were good again. But now, we have clearer answers. Especially that 2025 ASPRI study that looked specifically at seniors your age. You deserve accurate information. Not outdated advice from 1968. Not internet myths. Real science that helps you make informed choices about your health. If this video cleared things up for you, do me a favor. Hit that subscribe button. I make videos specifically for seniors who want real research, not fear-mongering or clickbait. And if you know someone who is confused about eggs, share this video with them. Knowledge is power, and accurate information can literally save lives.